Hi, Dr. Frank K. Kuamura here from MD Spine Care. You know, something that's asked of me all the time is, Dr. K, why did you get into spine? And there's many reasons. Number one, I think it's very interesting. Number two, I see that the spine care industry and the science of spine care is just expanding. We're in an area of growth. The growth that we haven't seen in many of our industries, our science, our biology, our cell growth, our regeneration, the new metals, the new plastic we're using. And that interests me because not only am I a doctor to take care of patients, I'm also a researcher and an inventor of innovative techniques and research and also 3D printing. So it excites me, and the main reason that I got into spine surgery and to taking care of people with spine problems is because we saw that we could make a difference in patients. Patients came to us hurting and unable to be who they want to be or who they need to be for many different reasons, and we could impact their lives and change people's lives to get back on the road to recovery and also be a full version of themselves. The other reason is I have a spine problem also. So I have a personal interest in this. When I talk to patients, I can speak to them from a patient perspective, which I was a patient. I went through the things that patients go through, the fear of treatment, the pain that they suffer, the limitations in their lives, and also ultimately the decision to have surgery. So one question I was asked is, Dr. K, how do you talk about individual care, and what does that really mean? Well, that means that we look at every patient as an individual. The person that we see has nuances or individual traits to them, who they are, what their demands on their body, what's their expectation to, and also what problems they present to us that we need to come to some solution. Many of our solutions aren't surgical. Many of our solutions are conservative care. We have an extremely robust wellness program that we engage people in to make people well and to heal. And that's the first line of treatment, is get you better and get you healthy. Patients that fail, that have those problems, and yeah, we do have to think of surgery sometimes. If we get to that point, we think of you as an individual, we think of you as your problem, we set up realistic goals, and we devise an individual plan for every single patient. One of the things that I've always asked me is, Dr. Kuamura, you were part of a large spine group and you had many colleagues, and I'm going to tell you, that was one of the best years of my life, and a growth phase in my career. Being around great doctors and good thinkers and good surgeons and taking care of patients. But you know what? I wanted more. I wanted more. I wanted actually to build a culture around me of like-minded people that took care of patients like their family. We don't treat patients, we change people's lives. And all of my employees, I am truly blessed that my employees are great people. I have a fantastic team. And if you come to see us at MD Spine Care, you'll get to meet some of them. And so why do that? Well, I can build the family around me that I want to take care of my patients and they also are extensions of me. So one of the things that excites me now in spine care is really this huge thought process of regenerative medicine. We're regenerating spine tissue, we're regenerating cartilage, we're regenerating bone. We're not just carpenters anymore. You know, and again, we're also engineering now the regrowth of tissue. We're engineering and helping patients utilize their own potential to heal, to go from an injured state. We help them heal with technology, and now they heal. And what happens there? A lot of our patients don't have to have surgery with these new technologies. The other thing that's really developing in our space is really 3D printing. I've been on research teams and actually been a professor in teaching 3D printing techniques, and that's amazing. And what it means for us now is that we can customize an implant or a piece of equipment that's unique to you. And as we know, we're all different. We have different parts in our bodies and different problems, and now we can take that information, we can download it, and I can actually print a custom implant for any of our patients. There's many things we do in our practice to build teams. And what does a team mean? It means that we're all members of this team and we communicate well. So one of the things we do every morning, we have a morning roundup. And what do we do there? We meet with every person, whether they're on site here at this location here at the main center of MD Spine Care or our satellite offices. We use technology. So we actually do Zoom calls with every member of our team every single morning. 8 o'clock, we're on the call, we're on the Zoom. And what do we do there? We talk about our day, we talk about what happened yesterday, we talk about patients. We have what we call TLC patients. Now every patient's a TLC patient, of course, But there are certain patients that reach our hearts and that need that extra care, extra things that we need to do. So every team member that we bring up and every time that's aware of those TLC patients goes that extra mile, the extra mile that we need to provide the care that these patients that truly may not have someone to help them through healthcare and through their surgery or through rehab, that we'll reach out to them. And we hold everyone accountable to not only treat the patient, right, which again, we don't treat patients, we change people's lives, but accountable to themselves, to our patient and our practice, and then the vision of our company.